Glenn Medical Center in Willows could lose its critical access hospital status designation. That's the word from the Centers for Medicare and Medicaid Services, or CMS. The North States News' Hannah Gutierrez stopped by the hospital today, and here's her report.
We save lives on a weekly basis, I think that's worth something. And I hope CMS can recognize that.
Staff at Glenn Medical Center in Willows are seeking support following a notice that the facility would lose its critical access hospital designation by the Centers for Medicare and Medicaid Services due to its proximity of the Colusa Medical Center, less than 3 miles short of the designation requirement of 35 miles. They say the loss would be detrimental to their emergency unit, which could shut its doors as early as spring 2026.
That when small rural community hospitals close, that people pass away, there's a significant portion of the population that get primary care services through our ER, and they'll drop out of care with the closure of the ER.
The designation provides critical funding towards the emergency department. If closed, those in need of care would have to travel to Enloe Health or Colusa Medical Center, a commute of life or death.
If they revoke our critical access designation and God forbid Colusa Hospital also closes down in a couple of years, what services are we going to have in the region?
Without this emergency room here, when those disasters happen in our community, the emergency response that Glenn County is responsible for, it won't have an emergency room or a hospital attached to it.
Glenn Medical has launched the Save Glenn Medical campaign with a petition to rally support that can keep its life-saving operations available.
If it can happen here in Glenn County, it can happen anywhere. Supporting us today is going to have a huge impact for the course of action in CMS's decisions moving forward.
The link to the Save Glenn Medical campaign can be found on our website, krcrtv.com. In Willows, Hannah Gutierrez, North States News.